Hello, this is Dr. George Sun from the Advanced Aesthetics Center. Today I'll be presenting a topic on health and beauty. Specifically, today we'll be talking about the 6 ways to conquer the quarantine fat. As we know, during the stages of quarantine, it's easy to gain weight and become fatter because of a lack of exercise, mobility, and of course, readily available food resources make us become much more chubby and much more lovely in that fashion. And of course, this becomes our before and after, something we do not like. And therefore, the demand for weight control, weight loss becomes even higher during this time. So how do we lose the quarantine fat? And we'll be covering a few important questions and topics. First, we'll understand what are the 2 types of fat we have in our body, what are the roles of lifestyle, how to monitor ourselves, and how to get to know our body better with testing, how to get the right help from the right doctor, and how to choose our weapon and tools against fat, and how to take action. First of all, understanding types of fat. In our bodies, we have 2 types of fat: subcutaneous fat and visceral fat. Subcutaneous fat is the type of fat you can pinch on your face, on your neck, on your back, on your bra area, your armpit, on your arms, on our thighs, inner thighs, flanks, and on our belly as well. There's also a second type of fat called visceral fat, which is non-pinchable fat located inside the abdomen. These are called intra-abdominal fat or visceral fat, and they're associated with organs. The reason we need to know this is that subcutaneous fat is very difficult to be exercised off with exercise or diet, but can be readily improved upon or eliminated, reduced, or melted almost permanently with medical tools. Whereas visceral fat can be so-called exercised reduced through dietary or exercise means, but these changes are not permanent. Quite often, when we gain weight, we have increased visceral fat as well as subcutaneous fat. Therefore, we often need to employ both tools. In other words, tools that reduce skin deposit fat, as well as tools to reduce visceral fat. So, first thing you need is we need to adopt the what I call lifestyle detox. Of course, lifestyle involves 4 components: exercise, eating habits, sleep patterns, and relaxation methods. The combination of proper exercise and eating habits is an extremely powerful tool. When we have cardiovascular exercise of aerobic nature, between 45 minutes to an hour, we upregulate and activate the good hormones and good genes. In particular, when cardiovascular exercise are preceded by intermittent fasting the day or night before, the impact of caloric burn and wellness and aging becomes enhanced. We know intermittent fasting leads to a phenomenon called autophagy or self-eating, whereby our immune system become upregulated and begin to digest away our old non-functioning senescent cells to produce more raw materials for the younger and more functioning cells. So this is a common advice I give to patients to exercise during the daytime for about 45 minutes or an hour with either quick burst of the caloric burning cardiovascular aerobic exercise or by brisk walking for an hour and a half or so, 10,000 steps. And this exercise can be preceded by nighttime fasting the night before. Again, this combination works very well for a lot of patients. So you can think about these. Sleep is very important for us. Those studies have shown that people who sleep fewer than 6 hours or more than 8 hours consistently tend to have more degenerative disease and over a long time. And ways to relax and to cope with stress are very helpful because we know individuals who have high stress hormones tend to have more problems with food metabolism, in particular with carbohydrate and food binging as well. Number 2 is it's important to monitor ourselves. In the old days, people used to go on scales only, but nowadays there are phone apps that can help to control, to monitor our weight, burn calories, and glycemic index. In particular, glycemic index is very helpful to let us know which food type give rise to insulin surge and therefore mess up our sugar metabolism. So there are apps which you can download to tell you which food type have very high glycemic index, so you should watch out for those. Thirdly, knowing your body better with testing is very helpful. These days, tests are very advanced now. We can even know your DNA to get some ideas what type of food your body like and maybe dislike. With hormones testing, we can know much better about your individualized level of thyroid, metabolites, hormones, food hormones, anti-stress hormones, stress hormones, sleep hormones, and even sex hormones to gauge some ideas about your metabolism. There are even tests to know about particular food type, which can make you gain weight as well, called a food immunology test. This fourth test is not directly related to fat or weight, but is important to know against our immune system for the COVID-19. And this test, of course, is the COVID-19 antibody immunity test. This test let us know if we had recent or past infection, now coming down with possible antibody and therefore possible immunity against the virus, and therefore possible protection against the virus in the future. Number 4, it's helpful to get a little help from your friendly doctor who is specialized in this area. Of course, not just any physician, but from a doctor, hopefully, who's specialized in wellness, anti-aging, and aesthetics. These days, telemedicine have come a long way very quickly in the past 2 months. The virtual consults can be done easily over professional platforms as well as layman platforms such as Zoom, WeChat, Google Meet as well. Specialist physicians can provide individualized monitoring as well as prescribing weight loss medicine and other supplements and individualized evaluation management over telemedicine. We do this quite frequently for patients, and patients have an easy way to maintain their weight, and are also reducing their weight also help to reduce fat as well. Number 5, you choose your tool wisely. As I said before, when people gain weight, they are disliked two parts of their body, not only the weight, but also increased skin fat. Therefore, we need to deploy two type of tools. One is to control weight. The other one is to control localized skin fat deposit. So there are two categories of tools we can use. One is surgical, the other is non-surgical. In terms of losing weight, we often resort to weight loss medicine. Most of them are oral, sometimes injectable. Some of the most popular oral medicine include Adipex, Topamax, and Metformin. Adipex is a caloric burn and appetite reducing medicine. It's been around for many decades already. This, over the course of 6 months, tend to reduce weight for about 5%. Topamax is another popular medicine, being more popularized in recent years. This medicine was originally used for a seizure, but was found to have anti-appetite and also caloric burn properties. This also tend to lose about 45% over the long run as well. Third medicine, metformin, and this has been used for decades as well for diabetes originally, now has been found to have important anti-aging properties and also gradual weight reduction property, maybe about 2 to 3%. So generally speaking, for medical weight loss, we usually aim for about 10 to 15% of your body weight to lose weight over the course of a couple months. Injectables can be used. These are bioactives, commonly involving use of methionine, inositol, and choline to better metabolize the digested fat. When it comes to localized fat deposit, there are also tools we can use, especially for the face. There is a fat melting injection called deoxycholate. The trade name is called Clobella, which can be used to permanently reduce and eliminate fat around the facial area and the neck area. It works quite well. The results are comparable to almost to surgical liposuction in the neck and face area. And of course, for body fat on the skin that is unwanted, such as the belly and flanks and love handles, we do have fat melting fat melting machines, and there are two type of categories: one using heat, the other one uses cold. The heat usually use either radio frequency or more effectively using ultrasound. Using cold, I'll typically use what's something called a cryolipolysis, also another popular technique, even though it doesn't does not tighten the skin as much as heat technique. Of course, there's always surgical technique to reduce fat deposits. Surgery, of course, does not reduce weight, but liposuction, of course, is extremely effective and is the gold standard to reduce localized fat deposits. So the key point to take away from this is when people gain weight, it's often important to deploy both methods. One method against weight, one method against localized skin fat deposits. So it's important to take action. The way we take action is to optimize your lifestyle, monitor yourself, get tested, work with your doctor specialist, and choose your tool wisely. So hopefully today we've gone over some information which will be helpful to you, and we'll see you again next time.